this morning. Honey, how are you feeling?
What?
No wonder you can't hear me. This is way too loud. There, can you hear me better now? Okay, well, I have to go take care of my other patients. Is there anything you need? Alright, I'll bring you your pills. Do you want your pain medication? Again? Okay, well, I'll be back soon. Good morning, Mrs. Wilson. My name's Sarah, and I'll be your nurse today. How did you sleep last night? Mrs. Wilson, how did you sleep?
What is it with you, all you young people? Why do you all mumble all the time?
Mrs. Wilson, would it be okay if we turned off your radio till we're done talking?
Sure, that's fine.
Okay. Can you hear me better now?
Yes.
Alright, do you mind if I check your hearing aids to make sure they're working properly?
Yeah, you can look at them.
Okay. Mrs. Wilson, does that sound better? Your hearing aids had accidentally been turned off. That could explain why you've been having hearing difficulties lately.
Yeah, wow, I can hear so much better. So many nurses have been in and out of my room this morning and no one's noticed that yet. Thank you so much.
It's no problem, Mrs. Wilson. I'll make a note of it so the other nurses know we had an issue with your hearing aids and that they can be checked more frequently. Is there anything else you'd like this morning?
No thanks. Now I can finally watch the news and listen to the radio since I can hear it.
Well, I'll be back shortly with your morning medications. Are you feeling any pain this morning? Can you rate your pain on a scale from 0 to 10? 0 being no pain and 10 being the worst pain of your life?
I guess I would say it's maybe a 4.
Okay, we could also use this visual pain scale instead. Which of these pictures do you think best describes your pain?
Oh, I like this one better. I'd say that one.
Okay, Mrs. Wilson, I'll be back soon with your medications, and I'll bring your pain medication as well. If there's anything else you need in the meantime, just ring your call bell.
Okay, thank you.
I'll turn your radio back on for you.
Thank you.
Alright, here are your pills.
Can you hand me the picture?
Yep. Oh, I'll have to go get a towel. Here, let me clean that up. I'll do this for you because you're taking too long. Your water pitcher is still really full. You need to start drinking more water.
I just don't feel thirsty.
Well, lack of thirst is something all older people deal with. You'll just have to get used to it.
Oh, okay.
All right, let's take your pills. I have to go take care of my other patients.
I'm sorry I made a mess.
It's okay. You just need to start to be more careful. All right, I'll be back soon with your breakfast.
Okay.
Good morning. I have your medications for you. Can I see your ID band, please?
Sure.
Can you say your name and birthday?
Mary Wilson, October 16th, 1935.
All right, thank you. All right, I'll move this a little closer so you can reach it.
Thank you.
Take your time.
Oh, I'm sorry I made a mess for you.
Oh, that's no problem. I'll get you a towel and clean it up. Accidents happen. It's better that you're practicing little activities like this so that you'll be more comfortable when you go home. It'd be good practice for you if you practice pouring water into your cup a couple times a day. It'll even be a good reminder to drink some more water.
Oh, okay. That's a good idea. I don't often drink very much because I never feel thirsty like I used to.
Lack of thirst is a normal sensation that many older adults experience. How about we make a goal by the end of the day that you try to drink half of your water pitcher?
I think I could do that.
All right, sounds good. You can take your medications now. Is there anything else you need?
No, I think I'm good.
All right, I'll bring your breakfast when it comes. And don't forget to drink some more water.
Okay, I won't. I like a good challenge.
All right. All right, here's your breakfast. I'll uncover it for you so you don't make another mess. Do you want me to feed you? All right, I'll be back soon to check on how you're doing. Well, you hardly ate anything. How are you feeling?
I feel fine. I'm just not very hungry, and the food doesn't taste right.
Well, all older people have decreased appetite and taste, so you're just gonna have to get used to it if you want to get better, because you have to eat.
Oh, okay.
Well, you need to try to eat more of your food. I'll be back. All right, Mrs. Wilson, your breakfast is here. Do you want to try to take the lid off your food by yourself?
Sure.
All right, take your time. All right, Mrs. Wilson, you look all set. Is there anything else you'd like?
No, thanks. I just haven't been feeling very hungry lately.
A decreased appetite is normal for many older adults. However, we need to make sure that you're getting the proper nutrition that your body needs to be healthy. How about you try eating half of your food tray, and I'll check back on you in a little bit.
Okay, I'll try my best.
All right. Mrs. Wilson, it doesn't look like you were able to eat much. Are you feeling okay?
I'm feeling fine. The food just doesn't taste right anymore.
Well, don't worry, Mrs. Wilson. This happens to many older adults due to a decreased sensation in taste and smell as we age. There are some different things we can do to help this. We can add some herbs and spices to your food to give them more flavor so you can enjoy them better. We should avoid adding salt to foods because high sodium levels can be dangerous to your health.
All right, I'm fine with trying anything to make this food taste any better. What can we add to give it more flavor?
Well, we can add some cinnamon to your applesauce and oregano to your scrambled eggs to give it some extra flavor.
Okay.
Does that taste any better, Mrs. Wilson?
Ah, that tastes much better. Those are very helpful tips. Thank you. I'll add the herbs and spices to my shopping list as soon as I go home.
Well, enjoy the rest of your breakfast and ring your call bell if there's anything else you need. I'll be back soon to assist you with your bath.
Okay.
All right, it's time for your bath.
Okay.
We're gonna start with your feet. Is that too hot?
No, it's fine.
All right, we have to do this quick because I have to take care of my other patients. All right, Mrs. Wilson, it's time for your bath. Can you test the water to see how that feels? Oh, good. You remembered to test the water with your elbow. Since you have diabetes and you're starting to get neuropathy in your hand, it's important to make sure that you test water or any temperature levels with your elbows.
Okay. Yeah, and it feels fine.
Okay, great. I have all the supplies here you need. I'll stay here to assist you if any of the areas you can't reach or if you need help.
Okay.
I saw your call bell was on. What do you need?
I have to go to the bathroom.
Again?
Yeah.
Okay, well let me grab your walker. Hopefully it's not a false alarm again. Alright, start to move to the side of the bed so we can get you up. Alright, let's stand up. Hurry up. Okay, you need to sit back down. We can't have you walking to the bathroom if you're gonna fall. I'll bring you a bedpan. You're not allowed to get out of bed anymore. Mrs. Wilson, I saw that your call light was on. What can I help you with?
I have to go to the bathroom.
Okay, let me grab your walker and we can get you all set. Okay, your walker's ready. Now we're going to move you to the side of the bed, but take your time. Alright, you can sit at the edge of the bed if you want to take a little break before we get you up. How are you feeling, Mrs. Wilson?
I think I'm okay.
Okay, well, we're going to slowly move to the bathroom. Make sure nothing's in your way. I heard you wanted to see me. What do you need?
Oh, I'm just doing fine. I love to read and I just can't see that well anymore to enjoy reading.
Well, many older adults experience decreased vision, and that's a normal part of getting old. So you're probably just going to have to get used to it. You already have glasses, so I'd probably just buy books on audio tape since you can't read anymore. And you can always just watch TV.
There's nothing else I can do?
Not really.
Alright. Can you turn the TV on for me?
Sure. Hi, Mrs. Wilson. I was just coming to see how you were doing.
I'm doing fine. I love to read and I can't see as well as I used to, so I don't enjoy reading anymore.
Well, decreased vision is a normal part of the aging process, but there's some different things we could try to help you be able to enjoy reading again.
Oh, really?
Yes, the most important part of improving vision is maintaining regular trips to the eye doctor and ensuring that your glasses prescriptions are up to date.
Okay, well, I already do both of those. Is there anything else I can do?
Well, simple things such as increasing the light in the room can make a big difference in a person's vision. Also, we can try to get a magnifying glass to help make the words look bigger and help the words look bigger so you'll be able to read them.
Yeah, I'll try anything. Reading makes the time go here so much faster.
Alright, well, I'll go get those things and I'll be back. Okay, Mrs. Wilson, I got you a lamp and a magnifying glass. We'll see if that helps you be able to read any better. Here's your magnifying glass. I'm also going to open the windows. Opening the blind on the window helps you get more light into your room.
Okay.
Is that any better?
Oh, wow, yeah. That's so much better. I can read my book now.
Great. Well, I'll leave you to enjoy your book. Let me know if there's anything else you need.
Okay, thank you very much.